Yes, we do provide emergency dentistry because sometimes things just happen. A lot of times patients, they can be eating popcorn, biting a kernel. The things I've seen routinely is people eating nuts, almonds, fracture teeth, crowns fall off, kids playing sports, get a tooth knocked out, things of that nature. And also pain and swelling. When a patient calls the office for a dental emergency, we get them in right away, same day appointment. And when they come in, we assess the situation, and our major goal is to get them out of pain, to see how we can help them so that they're not suffering. So when they come to our dental office, we'll take an x-ray so that I can diagnose it and see what is going on. Then I will give the patient several options. But my major concern that day for that appointment is to get them out of pain. A lot of times I will give them pain medication and an antibiotic if they have any swelling and things of that nature. And then I will follow up that evening with a call just to see how they're doing and see if they have any questions.